evening, everyone. Welcome to another interview with none other than the Honorable Martyn Roper. He's the Governor of the Cayman Islands, just in case you didn't know that. We have the pleasure of sitting with him today to kind of speak to him a little bit about what's been happening in the community, specifically in relation to COVID. I know a lot of people are very, very concerned over the last couple weeks, couple months really now that we've had community transmission. Of course, the Governor, thank you so much for inviting us here to have a little chat with you. You live in the community just like the rest of us.
Yep.
So you're out grocery shopping and doing all these other things. Has your behavior since community transmission, became evident? Has your personal behavior changed? What are you doing differently?
Yes, it has. I think, we've all been advised to do social distancing, mask wearing and sanitizing hands. So I'm wearing masks much more than I was before. Have fresh sanitizer in this room. And certainly as the civil service, we are wearing masks much more around the building. And certainly when we have meetings, when you're in your own office with a one-on-one, or when you're sort of at your desk, then that's fine. But when I have larger meetings in here, everyone is wearing a mask. So yes, I have changed my behaviour. I think it's about individual responsibility, and each of us now has a responsibility to protect ourselves, but to protect everyone around us and follow that public health guidance.
Yeah. I'm glad that you mentioned that, because even as it relates to vaccination, which we know that recently you got your booster shot, and we can talk about that in a minute, but people will say, well, it's my personal choice. And it's one of those things where it's a bit of a quandary, because it is a personal choice and you've got personal behavior, but this is a perfect example of where an individual's behavior impacts everybody else around them. We're in a community, and when you're dealing with a pandemic where the virus is so easily spread, you do what you should do: get vaccinated, social distance, wear your mask, wash your hands frequently, sanitize. All of those things are important to protect you, but it also protects everyone around you as well.
I think that's absolutely right. I do think that with the vaccines give us incredible protection, and it was brilliant that we got to 80% for first doses. Right. Huge achievement. Many people said that wasn't possible. We've done it, and that does give us a very good level of protection. And I think that's what we're seeing in the number of cases that we're seeing. Obviously, we were in this very safe bubble, and I understand for people it's a bit of a shock and it's uncomfortable that all of a sudden we get over 100 cases a day. Yes. Although that number has remained very steady, which I know Dr. Lee is reassured about. It's not going up in a significant way. And why people want to know about the cases, and we have to give that information. I think the focus needs to shift a bit to the hospitalizations, because, and that's where your point about individual responsibility comes in, because we all need to act responsibly to keep people out of hospital. That's what it comes down to at the end of the day. And our own personal behaviours will help us keep people out of hospital. But if we don't follow the guidance, if we break the rules, if we don't, where we can take the vaccine, which can help our community, then I do sadly think that is going to contribute to people going into hospital and heaven forbid worse than that. But the vaccine, it's fundamentally clear now, evidence from across the world, that vaccine, and we've got one of the best ones, the Pfizer one, it protects you, it stops you getting seriously ill or even worse, dying. It really does. And the booster, and I was really pleased we got UK agreement to roll it out to over 40s and to roll it out to teachers and frontline workers who have gone past the 6 months. The booster, the studies are showing it's extremely effective at sort of topping up your immunity levels, and again protecting you from this virus. So individual responsibility, as you quite rightly say, is so important to enable us to deal with this.
Right. Let's talk a little bit about the boosters. So a few weeks ago, yourself along with the Premier and some other government ministers, officials went in to get the booster. So essentially the recommendation is 6 months post your second shot, if you fall into the categories. So I know it was 50, now it's gone down to 40. And they've just opened it up for a lot of the uniform services.
Yes, and teachers.
And teachers,
Yeah,
yes.
yeah.
So that guidance you just mentioned comes directly from the UK. So they're the ones who are advising.
Yes, I mean, we have to follow broadly the UK's vaccine rollout, which is what we've done. But we do have some flexibility, and they've been very good in allowing us to be a bit more flexible and taking account of our community and the context of our community.
Right.
So the UK isn't rolling the boosters out to over 40s, but it is doing some frontline health staff. But we've gone further with teachers. They're not doing teachers in the UK, and we've done sort of our the police, CBC, fire, prison, etc. So we have gone a bit further than the UK, and the UK have allowed us. They've allowed us to do that. But that booster, I think we're at 25% of over 50s, which may be that there's a lag because people haven't gone 6 months yet.
Exactly.
But I would strongly recommend when you're eligible to get it, go and get it, because it really does provide additional protection. So really, really important.
Right. Wonderful. Now, yesterday we saw that the UK was actually the first country to approve a sort of antiviral pill as well, which is quite, an interesting move.
Yes.
For them, it came out maybe a month or so ago that it was having phenomenal results. So much so that the sort of testing phase was stopped on the recommendation of the CDC, the FDA, and some other private health providers to say we need to start rolling this out, get this in production. Do you see that as potentially being something that could be available to people in the Cayman Islands in the near future?
Yeah, I do. I very much do. I think these are really exciting developments. That one that the UK has approved. I think there's a Pfizer one under development in the US. I think they're just waiting for CDC or FDA approval. But no, we were talking to the UK about that this morning. It's only sort of just happened, so the news is really only just breaking. But I envisage that the UK, as part of its rollout, will want to support the OTs as well. So we will be looking. We'll be looking at how we can do that and how we can help get those drugs here. Of course, it's not for everybody. I think the idea is that if you get COVID early on, but you have a health vulnerability, so diabetes or heart disease or other comorbidities, then you would benefit because it can reduce again the chances of you having to go into hospital. Even if you've had the vaccine, which gives you protection, you get even greater protection. So particularly when we've got these health vulnerabilities at play as well. So I think it's really exciting. And again, we talk about living with COVID. So this is where it's going. We'll have these drugs which will help us manage COVID, because I don't think COVID is going away. We move from an epidemic to it being endemic, which means it's a bit like flu. It's there every year. Some people will get it. Sadly, some people will die from it, as happens with flu in the UK. They have 20,000 people sadly die every year from flu. So we're in that sort of transition phase to just living with this virus and getting on with our lives and just trying to live as normally as we can.
Yeah. I mean, it's amazing to think in the space of, roughly coming up in 2 years now, that over 5 million people worldwide have died because of COVID, and, many more dealing with long-term effects such as long-haul COVID. And Cayman has been in such an enviable and fortunate position that we've been in this bubble, and the bubble has burst.
Yeah, it has. It absolutely has. It has. But that shouldn't, unnecessarily concern us or make us really anxious. I think we just have to sort of keep calm and put our faith in our sort of health professionals who are doing an incredible job, and I want to pay tribute to them. I think they've had to work around the clock. Everyone involved in Travel Cayman, Dr. Lee, Dr. Rodriguez, HSA, Public Health, and the civil service. Civil service is working incredibly hard to keep our community safe. A lot of people say to me, well, we've got this community transmission, does that mean we're not going to relax the quarantine rules on the 20th of November? And I think there's no reason not to do that, and I sense the government is very committed to doing that. I think that's right. I think that I was struck by what's happened in the Turks and Caicos, and I was chatting to people over there. they've been open all the way through, so they've had tourists coming in. But what's clear is that the overwhelming majority of COVID cases were their own community, not tourists. So tourists coming in, and we will get some, but I don't think it's going to be open the floodgates. They're not really going to be a huge COVID risk to our community. The risk is more our own community. We're travelling backwards and forwards. We go to the churches, we go to the restaurants, we go to see each other in our homes. And in Turks and Caicos, that's where the COVID spread has come, not from tourists. So obviously it's a matter for the government, not me, but I don't see why this sort of upsurge in COVID cases should have any impact on 20 November, and we do as a jurisdiction have to move forward. And a lot of people are hurting economically, and we need to sort of get back as much of our tourism industry as we can in the months to come.
Right, absolutely. And right now the tourist figures, or the travelers I should say, account for maybe 2-3% of those who are infected. So already we see how those numbers are certainly not significant since community spread in August, right?
That's
September.
Absolutely.
But it's quite interesting. Now, the UK has been incredibly supportive in terms of ensuring that we have more than an ample supply of vaccines. Thankfully, we haven't had to waste any. I was so pleased about that because, just this week, a physician friend of mine said that Jamaica had to dispose of a bunch, and I couldn't believe it.
No, it's criminal. It's criminal to have to waste this vaccine. And Jamaica's rates are very low. I think it's only 13-14% of their people, and it's available. I think we've done incredibly well with the vaccine rollout, and I think particularly for our over 50s, the more vulnerable, the statistics are really impressive of those that can have it. I think we're over 90% in all of those age groups, which gives us an incredible level of protection, and that should give us some confidence and some reassurance that we can handle these cases that are cropping up. But I know it's a worry. You don't want COVID, and your child having COVID must be a very scary experience. But we know that for children, that they have extremely mild, if any, sort of impacts at all, and that's what we've seen so far. Actually,
I think the data supports it.
It does. It does.
Now that 30 to sort of 50 age group is becoming much more vulnerable. Because again, I don't know if it's just a youthful belief that I don't need to get vaccinated, I don't need to worry about it. But again, the data is demonstrating that those particular individuals are getting infected at a higher rate. They're getting much sicker at a higher rate, and even the death amongst that group is significantly I think is astonishing, really.
It is.
So what would you say to the average 30-year-old who might be listening to this interview, who's thinking, no, I've got youth on my side? What would be your word of advice to them?
I think you can have youth on your side and feel you're healthy, and a lot of people say to me, but we should let natural immunity sort of do its job. But the sad truth is that this has become a pandemic of the unvaccinated. And I was looking at some statistics from Bermuda just this morning, and it's really clear in September and October, people in that age group have been dying because they're unvaccinated. And I think particularly, with health vulnerabilities, it can happen. So to give yourself the best chance and to give your community the best chance, I still firmly believe that getting vaccinated is the right thing to do. But it's an individual decision, and I respect that. And I would just ask people to talk to your doctor, talk to your family and friends, and take a decision. But for me, on any balance of risks that you look at, it comes out overwhelmingly in favour of taking the vaccine. It really does. The risks of the vaccine are incredibly tiny statistically, but the risks of actually falling seriously ill and potentially dying are much more significant. And I just would urge anybody. We've got COVID in the community now. I don't think we can put the genie back in the bottle, as Dr. Lee has said. So it's not too late to get that vaccine, and even one dose gives you some protection until you get your second one later on. So really, really important.
Now, a little birdie told me that you're going to be leaving us soon.
Oh, gosh.
Into next year. So I'm sure we'll speak to you before you leave again. because we want to ask you at that interview a bit about your accomplishments.
Yeah,
whilst you've been here in the Cayman Islands.
I mean, I hope I'm not going anywhere just yet.
Okay.
I mean,
Yes.
certainly, I think 2022 will be my last full year. I'll probably be here a little bit into 2023.
Oh,
so
good.
it's still,
All right. So
it's
still got
only
time.
15 months
Yes.
yet. So it's not something I'm thinking about at the moment.
Awesome. So we've still got lots of time.
Yeah.
And that's wonderful.
Yeah.
Now you've been very involved in a lot of, and I just want to speak because we had this segment on our morning show talking about Miss Lassie, and I know you were there last night for the exhibit. So I didn't actually get an opportunity to speak with you last night before you left. But what were your impressions of her work and the home that she spent so many years in?
Yeah, I mean, I was really impressed with the home is just wonderful that's been preserved and maintained for sort of future generations. And I know that she only started in the 60s to paint, which is just extraordinary. And they're all so bright, and it's just a lovely exhibition. So I would encourage anybody out there who hasn't been or is thinking of going to do so, because I think it's really fantastic. And I pay tribute to the Cultural Foundation for all the work they've done to sort of get that up and running, and we've brought some of the paintings back from overseas as well. So I was really impressed by it, and she's an incredible sort of national icon, and we really need to treasure that. And I think Minister Bush as well, since he arrived as sort of Culture and Heritage Minister, he's bringing real new momentum, new passion, new enthusiasm, and I think he's really determined to sort of make a difference, and I welcome that, because Cayman, we've been here 3 years now, and you've got an incredibly strong and rich culture and heritage, but we have to maintain it and need to do even more to help sort of younger people understand it, because life has changed so much in 40 years. So it's one of these things that you can never do enough. You have to keep working at it. But I think that things are moving in the right direction.
Right. And if we could talk just briefly, when I think about preserving our history, of course, climate change and the impact of that comes to mind. And I know this week was a monumental week in terms of what was happening in Glasgow and Scotland, with 100+ world leaders coming together, trying to make this commitment to our natural environment, and trying to do what we can to work on gas house emissions and all these other things. And unfortunately, as human beings, we're really taxing the globe and our communities and the world that we live in. So what was your takeaway from, I know you had orchestrated the Premier being able to meet briefly with the Prince of Wales.
He did, and we helped facilitate that, and the ministry, Eric Bush, was very sort of active as well behind the scenes in fixing that, but we were able to help facilitate. I'm really pleased the Premier went. I know there's a huge amount going on here, but as we're living with COVID and life has to go on, and it was really important that Cayman's voice was heard on that international stage. So I think really good that he was able to go. And this conference is vital. I mean, I think the world we're at a tipping point, and I think we all recognise that we have to do more to make sure that the temperature doesn't rise. I mean, 2 degrees is not good news for someone like for us in Cayman. It would have, I think, a devastating impact on coral reefs. So we need the world to work hard on keeping it as close to 1.5 as possible. The conference is over 2 weeks, so leaders met at the beginning, but the actual outcomes won't come until the end of next week. So there's a negotiation going on now. And let's see, I think the jury is still out on whether the world is going to rise to the occasion. The UK as host is working really hard to try and pull that together. But I do think it's important, and I know the Premier is very keen that Cayman as well sets a good example itself, so that Cayman can encourage others to set a good example. And I think with his leadership and under the new Ministry for Sustainable Development and Climate Resiliency, I know that there's real ambition to make a difference, and that's something that I think is absolutely right, and I applaud that. Yeah,
wonderful. All right, so we are already in the month of November, and believe it or not, that means that Christmas is right around the corner.
Wow.
I know. I couldn't believe it the other day. I thought, 2 months left already?
Yeah.
Any special plans for the holidays? for you and the lovely Miss Lizzie? Do you have anything going on?
We haven't focused really enough
okay.
on it yet, but I'm actually I will be going to the UK later next week because it's the Joint Ministerial Council, so the overseas territories leaders and the UK meet once a year at ministerial level. It didn't happen last year, although in person, it was virtual. So I will be going to the UK to take part in that. Minister Ebanks is definitely going as well. I'm not quite sure. The delegation is still being worked on here because there's so much happening, which I understand. So I'll probably have to focus on Christmas after that, really. But that's the main focus coming up. But you know, here I love all the lights in the houses, which is fantastic.
Yes,
I've been given lots of sorrel. I get sorrel given to me every year by various people, which is really nice. And I know the beef is really big in Cayman. Yeah. So it's I think, and the weather is just lovely in Cayman at that time of year. So it's a fabulous time of year, and things do sort of slow down, don't they? People do get a rest and see family and friends. So looking forward to it.
Wonderful. Well, thank you so much again.
Well, thank
for
you.
taking some time out of your busy schedule and speaking with us.
It's a pleasure. All right. And,
Wonderful.
Okay.
All right, folks. Again, thank you guys so much for tuning in. As always, this has been another segment here with Cayman Mall Road, and I am Sandy Hill. We'll see you guys next time.